The latest figures show that there are over 1,000 autistic people in mental health hospitals in England, and we know from talking to them and to their families that all too often this is because they haven't got the right support earlier on and have ended up hitting crisis. And then the only choice for them was to go to a mental health hospital. And that's happening for far too many people at the moment, and that's why we see so many people still in hospital and why people are still being admitted.
My brother died and I had a baby at roughly the same time, and those two things together caused a huge amount of change, especially to routine in my life, and I simply wasn't able to manage. And I went to the doctor, and the first thing that he offered me was medication, and I was put on a 12-month waiting list for generic therapy to manage the bereavement. And so it meant that I got the wrong treatment, at the wrong time, and that led to me having a crisis, quite a serious crisis, and I really needed help. And so when the doctors said to me, "Alexis, go into hospital for treatment," that's exactly what I did, because I trusted and I knew that I actually needed help. Unfortunately, that led to 3.5 years in an inpatient, or numerous inpatient psychiatric hospitals, not getting the support that I actually needed. All I needed was some occupational therapy and some psychology and some regular contact with somebody that understands autism in the community. Maybe that would have cost £5,000–10,000, but instead 2.5 million was spent on care which was completely inappropriate and could never have worked for me.
4 years ago, the government and NHS England set up something called the Transforming Care programme. They said they wanted to build the right support in the country to stop autistic people and people with a learning disability ending up in mental health hospitals. What our analysis of the data from NHS England shows is that actually the number of autistic people in those mental health hospitals appears to have increased, not decreased. The numbers are actually 1/3 higher now than they were back in 2015.
I think the first thing that the government can do is review whether autism should be considered a disorder under the Mental Health Act. The Mental Health Act is for assessment, it's for treatment, and it's to manage mental health disorders. Autism is not a mental health disorder. The second thing the government can do is invest in community support. So if a person with autism is struggling and does go into crisis, they can get it from social care or from the NHS.
If you want to help us in our campaigning, then please do visit www.autism.org.uk/campaign. Find out what we've been doing in the past and what we're doing now to try and end the scandal.